So CASSINI is a late-breaking abstract that we're presenting here at the American Society of Hematology meeting in San Diego. CASSINI was a very large, multinational, 11-country, 140-center study that was run to ask the question, can we prevent blood clots in cancer patients who are at high risk for getting blood clots? This is a problem that's been known for years, that cancer patients tend to get blood clots, and they can be devastating for patients. You can end up in the hospital, you could potentially die from this, you can get long-term morbidity from it, you can have need to be on long-term oral anticoagulation for it. So lots of bad things happen when you get clots. We know how to treat clots once they happen, but it would be better if we prevented them from happening, because then you wouldn't have to deal with all the issues related to clots. A good way to find out which patients are at risk is a formal risk assessment tool. It's known as the Khorana score. So we use that to identify high-risk patients. And we took patients with locally advanced or metastatic solid tumors or lymphomas, and then randomized them to either 10 milligrams of Rivaroxaban or placebo, and then followed them for a period of 6 months. And we saw what happened to those patients in terms of clots, and we also did ultrasounds every 8 weeks while they were on the study just to make sure that we're not missing any clots that might be occurring. What we found was that there was a reduction of events in patients who were randomized to the Rivaroxaban arm, but the reduction was only significant during the time frame that they were actually taking the drug. So if you stop taking the drug, the risk went right back up again. So there's some important lessons for that. The good news is that yes, we can reduce these clots if patients take the drug. And if we reduce the clots, we not only reduce venous clots, but we also reduce arterial clots. And in a pre-specified analysis, combining the thrombotic endpoint, the primary endpoint, with all-cause mortality, there was a significant reduction in that as well. So I think the findings are very exciting and could potentially point to a new era where primary prevention becomes more of the norm and replaces sort of management of clots after they happen. Right now, we're excited about this study. There's actually a second study with a very similarly designed population called AVERT that has also completed and is expected to report out very shortly. So if these two studies sort of have the same findings, then I think we can really look forward to looking at primary prevention as a new way to prevent VT in this population.